In the last segment, we talked about how traumatic memories are stored as unfinished tasks, prompting intrusive thoughts, while the traumatic nature of the thoughts create a desire for avoidance. This overwhelming conflict can be reflected in behavioral changes. Abuse of any kind almost universally causes feelings of guilt, shame, and confusion. They may be afraid to tell anyone about the abuse, especially if the abuser is a parent, relative, or family friend. This is why it is important to watch for red flag type behavior, such as withdrawal from friends or usual activities, changes in behavior such as aggression, anger, hostility, or hyperactivity, or changes in school performance, sleep problems and nightmares, frequent absences from school, or refusal to do certain behaviors they once did, like riding the bus or going out with a certain group of friends. Injuries that do not match the given explanation are indicative of physical abuse. Neglect often results in delayed or inappropriate emotional development, or a loss of previously acquired skills. Neglect is also correlated with poor growth, poor hygiene, or hoarding or stealing food. Children who are emotionally abused appear to desperately seek affection from others. Disassociation, self-harm, and suicidality can be really terrifying side effects of abuse or trauma. In the excellent and eye-opening book called The Deepest Well, Dr. Nadine Harris discusses her experience as a doctor in a rough part of San Francisco. As she started her work in this area, the consistency of children coming in with failure to thrive, ADHD, heart problems, and a host of other problems led her to study the impact of trauma on physical health. The correlation was astounding. She has worked to create healthcare clinics that integrate medical and mental health professionals working together to increase the overall health, and she has seen amazing results. She is absolutely convinced, as Dr. Bessel van der Kolk titled his book, that untreated trauma requires the body to keep the score. As a note, just because your child is exhibiting any one of the changes listed above, it does not mean that abuse is playing a role in the behavior change motivation. Intuition, which we will discuss, and communication can be helpful in determining how you can best help the behavior and what it might be connected to.